And we say hello to our good friend Sherry Smith from Medicap Pharmacy, because there's something going on right now. We have about, what, a week and a half, a little more than a week and a half left in Medicare open enrollment. And if you know anyone that is involved with that, it's the time when you should really start reviewing what is offered from your plan.
And I think we're just kind of getting inundated with information, and we want to make it as simple as possible so people are making the right choices. So thank you for being here this morning.
Yeah, thanks for having me.
How can you break it down for us?
You know, it is so confusing, and Medicare itself is confusing, and all the plans are different and confusing. And I think what people tend to think is, it's so confusing that I don't want to deal with it. I like my plan that I have right now, so I'm just going to keep it.
This is the argument I had, and it really was, with my dad over the weekend. Asked him if he reviewed his plan. He said, I like what I have. I'm just going to keep it. Yeah, that's what he said.
Yep.
Okay, so what's wrong with that statement?
What's wrong with that is that just because you like what you have this year doesn't mean that it's going to be the same plan next year. And I will give you for instance. So on Thanksgiving, I did a plan review for my parents. If they would have kept the same plan that they had, even though nothing changed with their medications or anything like that, if they would have kept the same plan, it would have cost them twice as much.
What?
Twice as much. So it's just that so formularies can change.
Oh my goodness.
So what a formulary is insurance companies have a list of preferred medications, and they usually tier them. So tier 1, tier 2, tier 3, tier 4, and they have different copays based on what tier they're in. They can have a deductible. So some plans may have a deductible of anywhere up to $415, where you pay the first $415 before the plan starts paying anything. Some plans may waive that deductible if you're taking what they call tier 1 generics, which are the cheaper generics. Do you see why this is confusing?
So are deductibles changing? Is that why it doubled in price?
Some plans, so in this particular instance for my parents, it was just simply a matter of a medication that was preferred being not preferred, or generics being, the copays being waived during the deductible phase. So there was a new plan that had no copays for certain generics during that phase, so it actually cut the price in half.
Things got moved around even though everything was the same for your parents.
Correct.
Wow.
So that's why we say, even if you like what you have, check. It doesn't
get a review.
Get a review. And the other thing that can happen is, you know, insulins and inhalers are two of the most common culprits where it seems like one year, so Lantus and Levemir are two insulins that are very, very similar, very little difference between them, although drug plans will probably argue that, drug companies. But it seems like one year, every plan covers Lantus and nobody covers Levemir. The next year, everybody covers Levemir and nobody covers Lantus. So what you can do is talk to your pharmacist, and we can always check with your physician to see, do they really have a preference, or if it saves you, you know, hundreds of dollars, could we switch them to this? Can we swap? And so with the inhalers and the insulins, that tends to be very common. So we can help them save a lot of money, just because we're not just looking at what medications they're taking right now, but are there things that we could switch them to that would be even more cost effective and similar efficacy.
So obviously you want us to review our plans and make sure everything, you know, looking at medications and things we want to invest in that way. But is it common to take it to our pharmacist to say, hey, can you look at this, or am I saying the wrong thing and you're going to get inundated by all these people being like,
we do that. So I think a lot of people don't know that your pharmacist can do that. So we can't help you with, like, if you have, you know, if you have questions about the hospital and medical insurance, but if you have questions about your prescription drug plan, which is what we call the Medicare Part D plan.
I was going to say, which one of those segments is that? D?
That one we can definitely help you with, the D plan.
Great to know.
And actually that's probably where you should go, because your pharmacist probably has the most information about that. And like I said, we typically do a plan review, and we do that as well, a med review. So there may be things that we may say, you know, Lou, do you know why you're taking this? You've been on this a long time, and there may be things you're taking that you don't even need at this time. So just a good plan review.
Now, is the drug portion, the prescription portion of your Medicare plan, is this the one that really you should concentrate on when you're looking at your plans?
Yes, because typically you have the original Medicare, you know, that covers Part A and Part B, and then you have an add-on Part D plan that covers prescriptions. Some people will have an Advantage plan where it kind of rolls it all in together, but that's completely private insurance versus having Medicare sponsored Part A and B.
Okay,
So-
now would Medicap be able to look at that too and say, yes, this Advantage plan will cover you in this situation? Do you have the ability to do that?
We can look at Advantage plans as far as if they cover medications or not. We really can't do anything with the Part A and B side of that, but we can look and say, yes, your medications would be covered under this Advantage plan or not.
And does it matter at all if I say I'm go to Medicap, so I want to make sure everything is logistical
Yes.
with that because I want their convenience and everything they do for me? Does that factor in anything?
That's a fantastic point, yes. So some plans offer what they call preferred and non-preferred pharmacies. The non-preferred pharmacy, or the preferred pharmacy may be a mail order. Or
I was going to say, that's
Yeah.
one of the biggest sticklers there.
Correct.
A lot of people can't stand that.
Right. So, and I mean, I think some plans will cover most things at a pharmacy and at a similar cost. And so, if you have a pharmacy that you trust and the pharmacist is your most accessible healthcare provider, that should be someone that you're going to frequently for help, then you want to make sure that you have a plan that covers your pharmacy and your pharmacist. So.
Okay. Now,
Yep.
at
All
the
great
same time here, I'm
information.
going to another question about this because so many questions about the prescription drug policy. Would you also be able to tell whether or not people can get 90-day supplies of their
Yes.
drug as opposed to 30-day supplies?
Yes, definitely.
Okay.
We should be able to tell that when we look it up, it'll tell us if there's any quantity limits or if you can get 3 months at a time.
Because that saves you a lot of money.
Saves you a lot of money oftentimes, and we can even run a plan review showing you what it would be if you just got 30 days at a time for the year, or what it would be if you got 90 days at a time for the year. So we can, we can
That's a
help
lot
you
of great
with that.
information and a
Yeah.
lot of great help. So if you want to get in touch with your pharmacist, we obviously say go to Medicap because they're there to give you all the convenience and answers you need. MyMedicapPharmacy.com. There's a number there as well, and many locations.
Many
all around
locations.
here.
You can check us out too. Facebook. It's Medicap Central Iowa on Facebook. So.
Wonderful.
Well, you're not going to go anywhere because we're going to come back and
Right.
talk about something else that's going on
We have
today,
something exciting for Giving Tuesday.
which is today. We'll talk all about that when we return to CW Iowa Live.